badly destroyed lungs can get with this COVID infection. Unfortunately, despite the fact that it's been now almost 1 year since the pandemic started, we still do not know everything about this disease, how to treat it, why that 90% of the patients recover, but a small percentage do not recover. And what is the difference between those who recover and those who do not recover? And even on those who do not recover and require intubation or ventilation or intensive care, it's only a small percentage of patients who reach this level of destruction where we have to resort to ECMO or lung transplant. We still do not know what decides which patient will go which way. We've had young patients who have recovered, we have had older patients who have recovered, and we have young patients who have needed a transplant. But it's just to highlight that at the one extreme of this disease, the lungs can get affected so badly, as you saw, that it's like all the air is gone, it's solid tissue, there's no gas exchange possible. So this patient was kept alive for more than a month by an external lung, which is a machine. And because Tamil Nadu has such a excellent system of organ donation and distribution, he was fortunate and he was airlifted to this estate in the city, and fortunately he was able to get a good pair of lungs, and he is completely recovered, and he's going back. So the number of transplants worldwide for this condition is very few.
Initially he had fever, body ache, and they did the RT-PCR test for COVID, which was positive. And he was treated with medicines. But over a week's period, he became breathless, he had severe breathing difficulty, he was put on oxygen, then non-invasive ventilation, what we call BiPAP. But however, all these measures, his oxygen saturation became low. So the doctors treating him put him on ventilatory support. But in spite of putting him on ventilatory support, his oxygen saturation started coming down. That is the time the doctors treating him contacted MGM Hospital. So Dr. Apar Jindal, our pulmonologist, went to Ranchi and assessed the minister, and he found him to be very critical. So he immediately alerted our ECMO team. So the ECMO team from MGM went to Ranchi and put the minister on veno-venous ECMO. Now what is veno-venous ECMO?